The show is Senior Moments. Our topic today is Issues in Aging, Your Health with the doctors of UCLA Health. That would be Dr. Shi, Dr. Vahi, and Dr. Schroll. Dr. Vahi, we were talking about dementia before the break. Do you see that in your practice at all? Do you see even the beginning signs of dementia in some of your patients?
We do come across with patients where they might have just the subtle beginning signs of dementia, basically coming in with, memory issues, not being able to remember things. That's kind of how it usually, presents with patients coming to you and saying, like, my memory is still just not the same. I don't remember I forget things very easily.
But what if I forgot where I left my keys last night? Do I have dementia?
Not really. I forget my keys too, so I hope I don't have dementia. But it's more, when it kind of starts to interfere with your day-to-day activities or activities of daily living, not being able to kind of manage finances or, being able to go to the grocery store and, shop for yourself. So when it starts to affect your activities of daily living, that's when it kind of starts to become a little more concerning and, should be evaluated.
Could there be physical things that affect somebody's memory? Are there anything that you know of that affects people's cognitive ability, even on a temporary basis?
There are medical reasons, and anytime that we're evaluating somebody for dementia, we want to rule out the medical causes. That is one of the things that we do. So, certain vitamin deficiencies, common ones being like vitamin B12 deficiency, can cause cognitive impairments. Thyroid problems can do that, so we screen people for, thyroid problems. So there are medical conditions and issues that we want to rule out before, calling somebody dementia, which is not reversible or treatable by medications.
And not only that, but depression can be masked by symptoms of dementia. So it's very important to try and think of other causes. And then poor sleep, as we kind of spoke about before. If you're not sleeping well, then you're not going to have a good memory, not going to have a good concentration. It may present as dementia, it may present as depression. And so it is very important to weed these things out.
Medications as well. I know we kind of touched on it a little bit earlier, but several common medications can...
like what?
Not back to pain medications, but
there's...
I'm gonna get yeah, exactly. You'll really be forgetting your keys then. But gabapentin, Neurontin, again...
So if somebody is taking these medications, that could really affect their cognitive ability.
Absolutely, yeah.
Simple things like Benadryl. In the elderly patients, Benadryl can cause mental status changes, agitation, confusion, fogginess. So, that's why it's important to get your medications reviewed with a physician, because something that you may think is benign and available easily over the counter might actually not be working so well for you, or be, the cause for some of your problems.
And do you see this frequently in your practices? Do you see this very occasionally? Do you see adult children coming in with a parent or a loved one saying, I don't know what's wrong with mom, or I don't know what's wrong with dad? Have you come across that?
Absolutely. It happens very frequently. As we get older, especially with dementia, you're not able to express yourself as well as you used to. And so it can be confusing to try and get to the bottom of what the underlying issue is. And it is very helpful when children of elderly patients do come in as well, because they can tell us sometimes more than the patient themselves can tell us. And
so you all three of you welcome that feedback. We kind of touched on that a little before, but it seems like when you go to the doctor today, it's almost like, not with you folks, but some doctors, it seems like when you go in, the doctor hits the stopwatch, and when the stopwatch gets to 5 minutes, on to the next patient.
Yeah, I think for me, my relationship with the patient and the family is more of a dialogue than anything, trying to work together to figure out the underlying issue. and to find out what treatment will work for everyone.
So you just can't go and say, okay, this is treatment A, works for everybody.
No, it's it's individualized for every patient. You have to know exactly what situation they're living in, what are the circumstances underlying the condition. You have to take the family into account because you're not just treating the patient alone. I mean, you have to take the whole situation into the picture.
Sounds complicated. When people come in, do they come in with an agenda, or do people come in? A great example is at home instead, senior care. When we go to the doctor frequently, the caregiver will go in with their client, and the doctor will say, "How are you today, dear?"
Mm-hmm.
And that person will say, "Oh, doctor, I feel great. How are you?" And of course, we're not there because they feel great. We're there because there's some major problems.
Yeah, I think it is important. It is, really, it's easy when a patient comes in with an agenda. We can try to fix one problem. But also it is important to see your physician when you're feeling well, so that we can kind of looking at things that don't necessarily have symptoms that we can try to fix, and we can take a look at preventing diseases from occurring in the future.
Kind of like a baseline.
Absolutely.
Yeah.
Yeah, and sometimes, I think it's a good idea because I see this commonly, when you come into the office, you're there. Sometimes people get nervous. You're seeing the doctor, and I always try and tell my patients, anything that comes up, in the time that I see you, write it down. That way when you come in, you're not gonna, forget things that you wished you'd talked about, when you leave.
Yeah, and it also is important, when I meet a patient for the first time who's feeling well, I know what they look like. I know how they act when they're feeling well. So when they're not feeling well, they come in. I can see what the issue is, and it gives me a better clue of where we're going to go with it.
And where we're going to go right now is we're going to go to a break. You're listening to Senior Moments on Santa Clarita's hometown station, AM 1220 KHTS. We're talking about issues in aging, your health, with the doctors of UCLA Health System. This is Senior Moments on Santa Clarita's hometown station, AM 1220 KHTS. Issues in aging is our subject today. Your health is the point we're zeroing in on. We're talking with the doctors of UCLA Health. Let's talk a little bit about screenings and preventative medicine. Dr. Vahi.
So screening and preventive medicine, I believe, is very important because it kind of lessens the burden of disease on you. And if the preventive screening tests that we have should be utilized. Most importantly, the cancer screening. So there is certain age-appropriate cancer screening which everybody should have.
Like what?
Starting at age 50, everybody should have a colonoscopy to screen for colon cancer. And it's usually every 10 years, depending on if they find any polyps or any concerning lesions, they might screen earlier. But starting at age 50, everybody should have screening colonoscopies. There's screening for breast cancer and cervical cancer in women. So breast cancer screening can start at age 40. 40 to 50, it's kind of a dialogue with your doctor and your personal preference. But starting age 50 again, every 1 to 2 years, women should get screening mammograms. And it continues till you have a life expectancy of at least 5 years. We would continue the screening for breast cancer. And cervical cancer screening, again, starting at age 21, actually. That one, usually, if you've had normal pap smears all along, at age 65, you could potentially have a conversation with your doctor and stop screening for cervical cancer after age 65 because there's just a reduction in the incidence after that and decreased risk.
Sure. Some of the other less known screening tests that we do are for men who have been smokers in the past. Who are over the age of 65 are at increased risk of the large artery coming off of their heart dilating and rupturing, and that that can be extremely serious. So for patients, men who are over the age of 65 who have smoked in the past, we do recommend evaluation with an ultrasound to take a look at that main artery coming off of the heart as well, called the aorta.
And I think prostate as
cancer
well.
too.
Yeah. So seeing your physician, regular for prostate exams, as well as PSA, which is just a simple lab test that can be done to screen for prostate cancer.
So how often do I need to see you folks?
Annually, at least, so once
Annually.
a year. And then depending on, again, it's individualized, but everybody should see their primary care physician at least once a year. Also see, an eye doctor once a year to make sure that the vision is okay. But again, it depends on how many medical conditions you have, how your diseases are being controlled. We will decide on the frequency that will be best suited for you.
Oh man, once a year. Wow.
Yeah, I think there are, especially as we get older, we do want to try and detect things as early as possible and prevent issues that can be imminent or even a problem down the road. And so to drop in, check in with your physician, even if you're feeling well, once a year can really go a long way.
Once a year. But for these screenings wouldn't necessarily have to be done once a year, would they? Or would they?
Well, like for the mammograms, you would do it once a year. The PSA checks, generally, if you're doing the blood test for the prostate cancer screening, that would be once a year. But it just isn't for, the cancer screening that you'll see your doctor once a year. As we talked about, medication reviews, monitoring, like if you have high blood pressure, checking if your blood pressure is well controlled, if medication doses need to be changed. And then there are vaccinations too that, at certain ages you need to have certain vaccinations. So it's a review of everything, and that's why it's a good reason to see your physician at least once a year.
And how would people in our audience contact you?
So the best way to contact me, I practice at the UCLA Santa Clarita Primary Care and Specialty offices, which is on McBean Parkway. The number to be reached would be 661-753-5464. And you can call into that number and ask to be contact me.
I also work out of the same office as Dr. Vahi, Dr. Shi. And our office is right next to the Henry Mayo Hospital. We do take walk-ins as well as same-day appointments, so you can give us a call at 661-753-5464. Or because we do take walk-ins at this time, if there is anything going on or you just want to say hi to us, just drop by, and more than likely we will be able to see you in a timely fashion.
Dr. Schroll?
And I'm right next to these guys. I see patients with pain any part of the body. So the number to call my office is 661-255-2420. Happy to help anybody out there with pain.
Thank you for listening to Senior Moments. We'll be back in 2 weeks on AM 1220 KHTS.